What is high blood pressure? Variability in blood pressure appears to predict the risk of stroke more powerfully than high average or usual blood pressure. 3 papers published simultaneously in The Lancet and another study in The Lancet Neurology all support the idea that variability is the more powerful indicator. These studies by Professor Peter Rothwell and colleagues at the University of Oxford have major implications for diagnosing and treating high blood pressure to prevent heart disease and stroke. Prior to these studies, it was believed that the underlying average blood pressure determined most of the risk of complications from hypertension and all of the benefit from the drugs that are used to lower blood pressure. In these studies, Rothwell's team found that variability of blood pressure between visits to clinics was a strong predictor of angina, heart failure, myocardial infarction, and stroke independent of mean blood pressure. This contradicts assumptions in current medical guidelines that patients with only occasional high readings do not require treatment. Now it is becoming clear that such patients have a high risk of stroke and other complications. Occasional high blood pressure that may be called episodic hypertension are associated with a high risk of stroke and can no longer be considered to be benign. Rothwell's team also analyzed previous trials comparing the effects of blood pressure lowering medications. They found that different blood pressure lowering drugs have different effects on blood pressure variability. Certain prescription drugs increase blood pressure variability, which is dangerous, and others decrease variability, which is helpful. The researchers also found that these effects correlated with differences in the effectiveness of the drugs in preventing stroke. The research shows that many patients need blood pressure stabilizing drugs as well as blood pressure lowering drugs. That's a new concept in medical care, and it's important to talk with your doctor about reevaluating any medications you're currently taking that affect your blood pressure. In fact, it's a good plan to regularly discuss all the medications you're taking with a doctor so you are aware of possible interactions and side effects. Even doctors are joining a national prescription drug awareness campaign that is attempting to get 1 million people to take a better look at the medications they're taking. Take a better look at Tennessee Health Insurance plans to for extra help with prescription medications. Health insurance in Tennessee can include discount cards to lower your cost for medications. In addition, 2 of the largest providers of health insurance for Tennessee, Aetna and Anthem Blue Cross Blue Shield of Tennessee, are offering at-the-home delivery for popular medications. That includes maintenance medications that are used to treat heart disease. Tennessee Health Insurance members who enroll in mail-order prescription programs may also receive a discount for the first time they fill a prescription. Many programs offer additional coupons, free shipping, and other perks to make filling prescriptions more affordable and convenient. Some programs even offer reminders when it's time to refill a prescription. Not only is it important to be fully informed of the benefits and risks of medications and how to get the most savings on prescriptions, but it is also important to be educated about non-drug alternatives. In the case of your blood pressure, several alternatives can help. Eating plenty of fruits and vegetables, exercising regularly, and keeping your weight under control can lower systolic blood pressure by about 10 to 15 mmHg. Systolic pressure is measured while the heart is beating, and diastolic pressure is when the heart is at rest between beats. Blood pressure is measured in millimeters of mercury, recorded as mmHg. The systolic pressure is always given first in a blood pressure reading. For optimal health, those numbers should be lower than 120/80 mmHg.